Now let us discuss about chlorpromazine. It is one of the drug which can be used in schizophrenia. Okay, before understanding about the mechanism of action of that drug, initially we have to understand what actually happens in schizophrenia. Okay, come on, let us understand. In our body there is dopamine, we all know it. So dopamine can act through four pathways. First one is mesolimbic pathway, mesocortical pathway, nigrostriatal pathway, and also tuboinfundibular pathway. Okay, in our body there is dopamine, it can act through four pathways. Okay, so daily we are not having any hallucinations, delusions, any altered behavior we are not having, so this is normal. So whenever in schizophrenic patients, what happen, in out of these four pathways, in some pathways there will be increased dopamine and in some pathways there will be decreased dopamine. So that is the reason the schizophrenic patients are having some symptoms. So whatever the symptoms, okay, whatever the symptoms are happening due to increased dopamine are called positive symptoms. Whatever the symptoms which are happening due to decreased dopamine are called negative symptoms. Okay, what all positive symptoms are there? Like hallucinations, delusions. Okay, hallucinations, delusions, altered behavior we can take. And what are the negative symptoms? That is due to decreased dopamine, like lack of motivation, a lack of ability to enjoy life, and altered speech, something will be there. So these are negative symptoms. So okay, now I understood about negative symptoms and positive symptoms. So in schizophrenic patients, in which pathway there will be increased dopamine? Yeah, in mesolimbic pathway there will be increased dopamine, and in mesocortical pathway there will be decreased dopamine. Okay, so now we are using what drug? We are using chlorpromazine, right? Okay, we are using chlorpromazine. Okay, this is an antipsychotic drug. Okay, now we have to know the mechanism of action of chlorpromazine. Okay, so what it does means, this chlorpromazine will block all the D2 receptors. In mesolimbic pathway it will block D2 receptor, in mesocortical, nigrostriatal, in every pathway, all these four pathways it will block the D2 receptors. Okay, so what happened in the mesolimbic pathway, due to increased dopamine, what is happening? The positive symptoms, that is hallucinations, delusions are happening, right? So here we are by giving the chlorpromazine we are blocking the increased dopamine effect. So what happened? This hallucinations, delusions will not be happened. See, because of increased dopamine only this hallucinations and delusions are happening, right? Because of increased dopamine in the mesolimbic pathway. So whenever we block this dopamine receptor in the mesolimbic pathway, we'll cure the positive symptoms. Okay, we cured. So whenever this blocks in the mesocortical pathway, see, in the mesocortical pathway the symptoms are happening due to decreased dopamine. So already there is decreased dopamine, but we are here again blocking the dopamine receptor. That means the negative symptoms, which are like a lack of motivation, which are happening due to decreased dopamine, by giving chlorpromazine and blocking the dopamine pathway, we are giving, like, we are worsening that symptoms. There is already decreased dopamine, again we are blocking the dopamine receptor. So what is the use? So here negative symptoms may become worsen or maybe normal sometimes. Okay, negative symptoms sometimes they may become worse, or okay, in normal range they can be there. So I think you understood what is the difference between positive and negative symptoms. Then in the nigrostriatal pathway there is balance between dopamine and acetylcholine, right? So here also we are blocking the dopamine receptors. So what happens? Acetylcholine will be increased, so there might be symptoms of Parkinsonism. Okay, in the nigrostriatal pathway, by blocking the dopamine receptors, as dopamine decreases and acetylcholine somewhat increases, there might be symptoms of Parkinsonism might be there. And then in the tuboinfundibular pathway, normally what this dopamine do means, it will stop the prolactin. Okay, it acts as a brake on the prolactin. But as we are blocking the dopamine receptor in the tuboinfundibular pathway also, like prolactin brake is removed. Okay, that means prolactin shows its action more. So what happened? There will be galacturia, gynecomastia can be seen. So this is the action through this dopamine receptors, but it doesn't act on dopamine receptors only, it will also act on some other receptors, that is alpha 1 receptor, histaminic receptor, then also muscarinic receptors it will act. Okay, then it will act also on 5-HT2, 5-HT hydroxytryptamine, sorry, 5-HT, this is 5-HT2A. Okay, in all these receptors also it will act. So normally what happen in alpha 1, now it see, whenever this alpha 1 receptor normally get activated, it will constrict the vessel, right? But here we are blocking all this. Okay, we are blocking all this, we are not activating, we are blocking all this. Normally alpha 1, through alpha 1 receptor there will be vasoconstriction, but here we are blocking. So what will be there? There will be vasodilation and also fall in BP. So BP may fall. So sometimes there might be in adverse effects we can write orthostatic hypotension due to decreased BP. And then in through histaminic receptors there might be like a sedation will be there. Okay, sedation, dizziness, and weight gain will be there. Okay, then muscarinic receptor, here anticholinergic. Okay, anticholinergic side effects are there. What are that? Due to blockade, dry mouth will be there. Okay, dry mouth will be there, constipation will be there, urinary retention will be there, blurred vision will be there. So those are the anticholinergic side effects. And then this one, in the 5-HT2A receptor, through whenever this chlorpromazine acts on it, there will be slight, very slight increase in dopamine, but it cannot stop the extrapyramidal side effects. Okay, I did not tell, right? This in the nigrostriatal pathway, they are Parkinsonism symptoms are happening, right? Those are also called extrapyramidal side effects. Okay, this 5-HT2A will very slightly it will increase dopamine, but it is not that effective. Okay, it is very least amount. So this is all about the mechanism of action of chlorpromazine. I think you understood. Okay, comment in the comment section.